At least 48 million Americans have some form of hearing loss, but the good news is with the advances in treatment and technology, there's a good chance something can be done about it. A few months ago, I brought you this story about the benefits of having a multitude of hearing health services all under one roof. If you have a hearing or balance problem, you might be referred to a specialist for additional treatment. Should you go see an audiologist or an ENT? Well, the answer is sometimes, maybe both. An audiologist is a healthcare professional who can evaluate, diagnose, and manage hearing loss disorders. Audiologists have earned a doctoral degree or a master's degree in audiology and must be licensed or registered in their state of practice. Your audiologist will be able to perform a thorough examination of your ears, hearing, or balance system and be able to recommend the appropriate follow-up. If hearing loss is found and hearing aids are an option, an audiologist or licensed hearing aid specialist are experts in the selection and fitting of appropriate hearing aids or other amplification. If a potential medical issue is found, the audiology specialist will likely refer you to an ear, nose, and throat physician for treatment options. Audiologists and ENT physicians often work in cooperation with each other to find the best treatment options for their patients' needs. We talked to Paige Holt, Doctor of Audiology, with the hearing aid and audiology specialist at Lake Ear, Nose, Throat, and Facial Plastic Surgery about the benefits of having audiology services and ENT specialists all under one roof.
If I see you today and you have an ear full of earwax or a swollen ear or an ear infection, I can say we need to walk down the hallway and have my physician take a look at this. Or if I say I don't feel comfortable removing that earwax because it's too close to the eardrum, I need you to see one of my physicians, then it's all right here. At the same time, my physician looks at someone with an ear infection or a swollen ear. They can treat that, they can get it under control, and then we work very closely hand in hand. I fit the hearing aid, we monitor, is there a recurring infection that needs to be treated, and we have some patients that will see the physician monthly for wax removal or management of their condition, and then they'll see me when they're in here so that we can clean their hearing aids, make sure that they're not carrying bacteria, and keep them in a good working condition. And there are times when I may be puzzled on what do you think would be the most appropriate hearing aid for this individual, and so I will walk down the hallway and I will ask my coworker who is a hearing aid specialist, what products have you tried recently? Have you tried a product on a hearing loss that looks like this, and how did it work? And so we work together and we get feedback on one another, and sometimes if I'm having a difficult time understanding what the patient is trying to explain to me, I'll ask her to come in and listen and see if she understands a little bit better how we can correct that problem. We see patients every day, all day long, on the spot, as the physicians are evaluating medical conditions. Someone will come in and say, my ear is plugged up, I have ringing in my ears, I'm congested, and the doctors cannot always see exactly what's going on in the hearing nerve. So they'll send them down the hallway where we will do a diagnostic hearing evaluation and help them determine if something can be treated medically. If it cannot be treated medically, if it appears to be more of a permanent degeneration of the hearing nerve, then we will take over in our audiology department and begin to counsel them and recommend hearing aids.
For more information on the hearing aid and audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Adept Audiology story link on our homepage at yourhometownhealth.com.